Hi, I'm Dr. Duke. Most head and neck pain sufferers are women. As a matter of fact, 75% of all headache and neck pain patients are unfortunately women. There's over 30 million diagnosed migraine sufferers every year who are treated medically with nerve medications, gabapentin, Neurontin, Lyrica, others. And I'm here today to kind of show you briefly how we're able to very safely and gently treat these headaches and neck pain sufferers without having to use the medications all the time. And this is Carrie Kelly. She's a renowned yoga instructor who recently did a TED Talk. Please look her up. And the fact is, even experts can use our care. And Carrie is a perfect example of that because she was treating her head and her neck pain with yoga, trying to create slide and glide and mobility. And then things got worse, and then she found our office. So we're going to turbocharge this session. I'm just going to show you a few things that we do in the beginning. So first, we try to restack the posture. And you can see from Carrie, unfortunately, she has a very forward head posture. And even with all the yoga she's doing, it was pushing it in the wrong direction. So first we try to squeeze the blades back, and then we try to pull it back in. And you can see it's pretty challenging for her. We picked a broken model to help us today. Try to pull it back in a little bit more, and you can see how the muscles get very tense in the front. That's very common with head and neck pain sufferers. Let's take this hand, put it to your lower back area. Take your other hand, grab your head nice and gently, and kind of just pull it to the side, turn to me, and that will specifically target the anterior trapezius and the scalenes. These are muscles that trigger headaches in the head and the neck. And now rotate your head towards your axilla, and now gently kind of pull it a little more ear to shoulder, and you can see how it's pulling on the other tissues underneath here. Relax for a second. I want you to turn and face that direction for me. I want you to take the Dynaband, and I want to show everybody the strength exercise. It's so easy to do, and just one of many that we try to go over. Try to retract the blades, and now rotate out. Working on the external rotators of the shoulder blades, and it squeezes the trapezius. When you do this, look straight ahead, try to pull your head back in. A little bit further back to me. Very challenging because unfortunately she also has a little arthritic change, a degenerative disc, and we most recently found a herniated disc that we could talk about later. Another exercise that we reviewed earlier is to gain mobility underneath the shoulder blades because there's many muscles that attach the shoulder blade to the head and the neck that can trigger an arthritic change and can trigger forward head posture. Show them that angel exercise where you kind of pull up, out to the side, squeeze back and down. Don't overarch your back. Try it again. All the way up. Squeeze the blades. Very nice. Come all the way back down. And then relax. Patients are often nervous with sports chiropractic care. They associate the cracking that people think is associated with joint manipulation and headaches and neck pain. And in our practice, we specialize in soft tissue techniques, and we have a very gentle way of approaching these conditions without having to use that cracking that's associated with chiropractic care. So we're expert in something called active release. As a matter of fact, we also teach at their seminars. I want you to hold your arm here. Active release is a way that the patient actively moves and we release scar tissue and adhesions. So head and neck pain patients commonly have that area right here. Reach across to the opposite kneecap. Tuck your chin a little to the left. And then I am really, oh yeah, right on that adhesion or that knot. And then she moves, and then that adhesion or nodule tends to release itself from being chronically in spasm. Another one I like to work on is the rhomboid. Reach across, tuck your chin down, and then we sweep just down like that. Again, another common area that's often relieved by this type of technique. Sometimes people have been suffering for so long that we have to go a little bit deeper. So we'll use metal instruments called Graston instrumentation that goes a little bit deeper than what our hands can get. So I'm going to have you reach across your body, and then we gently just kind of scrape along the fascia, and that releases the adhesions. I want you to tilt your head to the side. I get along the anterior trapezius. I usually have the patient prone, and we'll get into the rhomboids. There's many different ways to do these techniques. And then lastly, what we'll do is when it's so short and so tight and so chronic, we'll use something called radial shockwave therapy. It's a pneumatic device that delivers thousands of pressure waves within a matter of minutes, and it's handheld. We're the only full-service rehabilitation center in Manhattan that uses it in a non-surgical setting. So I'll find the nodule right about here, and then we'll start delivering the impulses. And I'll hold it right over the knot that's so chronic that it would take me weeks in order to relieve that pressure. We can get this done in a matter of 3 and 4 sessions. There's much more that we do in this office, so please peruse our website and see what other areas that we can possibly help you with. I'm Dr. Duke, and this was Carrie Kelly. Thank you.